So every child's different. Your patient or your child might not always be symptomatic. When you have a low hemoglobin or anemia. So your hemoglobin is what oxygenates your body. So sometimes when you have a low hemoglobin, we also call that anemia. What it'll look like, your child will feel dizzy, faint, they'll be really fatigued. You'll see them taking naps a lot of the times. Unfortunately, it's a little bit harder with the younger kids to see what it looks like because they can't describe how they feel. But with the older kids, you'll see a lot of headache. Otherwise, they can also be pale. And when it comes to platelets, the biggest thing we're worried about is bleeding. So seeing bruises in places there shouldn't be bruising. So, if your kid hits their knee, if you hit your knee, you probably get a bruise too. But when you see bruising all over their abdomen, somewhere there shouldn't be bruising, that's your biggest concern. We also look for petechiae. They're little purple dots, and they kind of look like pinpoints on the skin. And then our other big thing is when patients brush their teeth, you'll see bleeding in the gums. So a lot of times we will transfuse our kids. During treatment, it's very common for them to either need a blood or a platelet transfusion. When it comes to blood, we usually say our threshold for hemoglobin is less than 7. Some patients, if they're symptomatic, will transfuse under 8. Sometimes patients can go below 7 and maintain a normal living. So usually if your hemoglobin's below 7, that's kind of where we say we probably will transfuse your patient or your child. And then when it comes to platelets, it's below 20,000. So if your child's getting a procedure, that's really the only case we will not wait. If they're below 20,000, in that case, they do need to be over 50,000. So unfortunately, when your patient or your child receives chemotherapy, it doesn't differentiate between the good and the bad cells. So that chemo will kill all cells in the body. So what happens is usually 9 to 14 days after your child receives chemotherapy, you'll expect all their blood counts to go down. So their platelets will be at their lowest point, their hemoglobin will be at the lowest point, and your child will not have an ANC or will have a very low ANC, making them neutropenic. So when your child comes in to make counts, so at different phases in the chemotherapy protocol, they are required to have an ANC above a certain level and platelets above a certain level. If your child does not meet those criteria, that simply means their body needs to rest. It's something we see all the time. It's not something to be worried about. If your child doesn't make counts on day 1, we're not worried, it's expected. What is most important is that your child is able to fully recover because that chemotherapy is going to drop them down again. So we don't want them to be low and drop them further down. We want to make sure they're at a healthy place where when they do get dropped low and those counts do all plummet at 9 to 14 days, they're able to recover from that low point.